Stephen Hawking once said, "I think those who have a terminal illness and are in great pain should have the right to choose to end their own life, and those that help them should be free from prosecution." My name is Diana McWilliams, and I will be giving you a speech on Huntington's chorea. Huntington's chorea is a disease that is identified by its jerk-like movements, withering movements as well. It was discovered in 1872 by George Huntington. Chorea itself, the word itself, means chorus or group of dances in Latin and Greek terms. And while Huntington's chorea is normally seen in older women, it is not exclusive to older women. It does affect men and it does affect children as well. The trait is itself is a gene mutation. That is, if you get the mutation, you will get the disease, but you only have a 50% chance of passing this disease on to your children. So it's best to get tested before you have children if there's any suspect that you have a disease or someone in your family has this disease. Adult signs and symptoms include involuntary movements and withering movements with your muscles, which includes rigidity and contractions. There is slow or abnormal eye movements, impaired gait, posture, and balance, so you're going to have trouble walking. There is difficult with physical production of speech and or swallowing, so they have a lot of issues with talking and giving speeches. This mental signs and symptoms for an adult are difficulty organizing or writing or even focusing on tasks. They have problems prioritizing. There's a lack of flexibility or a tendency to get stuck on a thought. So if they get stuck, they can't move on to something else. There's a lack of impulse control. There's lack of awareness of one's own behaviors and slowness in progression of thoughts and finding words. And there's also a difficulty to learn new information. So you're going to have a lot of problems with these people. They're not going to understand what's going on, why they can't get something exactly right. It's a lot of times actually confused with obsessive compulsive disorder. So that's something you really want to watch out for. Adolescent onset, it can start as early as 7. It just depends on when it starts in your life. The behavioral changes with an adolescent onset is loss of previously learned skills, both physical and mental, rapid, significant drop in overall school performance. So they're going to start forgetting what they were doing in classes, and they're going to be having behavioral problems. Also, something a lot of times, if it's adolescence, it could be described as ADHD. So it's one of those you really have to know your family history. Physical changes in adolescence, they get contracted or rigid muscles, which affect their walking, so they're going to have problems walking. Changes in fine motor skills, so they're not going to be able to write as well. And they're also going to have tremors or involuntary movements, which is jerking movements, which is what it's usually characterized by. And they could possibly even start having seizures. Diagnosis is based on several different things. They'll do a neurologic exam, and they'll also do a psychiatric exam to see what's going on. They will do an MRI and CT to see the brain function and what's going on up there. And there's also a blood test that they'll do for DNA markers that will indicate whether or not they have cystic fibrosis. Unfortunately, there is no treatment for this disease. All you can do is treat the symptoms and hope for the best. Like I said, it's not picky between men, women, adults, or children. And the most heartbreaking ones are when you have a child that's involved in this and they're doing really, really well in school, and then all of a sudden one day everything starts going down. The thing with this disease, it can start as simple as just a simple little twitch with your hand or your wrist that you can't control, dropping a spoon or a fork somewhere in a restaurant, and then it just goes down here from there. The disease progresses at its own pace. It's different for everybody, so it just depends on who you are and how fast it's going to progress. With the difficulty swallowing that you see a lot of times with this disease, you're going to have a lot of respiratory issues, pneumonia especially, which is what a lot of people of this disease die from once they can't swallow and they aspirate some fluid somewhere, and they're going to get pneumonia. And, that's usually what gets them first. Treatment is going to be treatment of the symptoms and different therapies: speech therapy, physical therapy, occupational therapy. Try to maintain as normal of a life as possible as long as you can. Unfortunately, This disease is absolutely terrible. There's nothing you can do about it other than if you think you might have the disease, get tested before you have kids. Don't risk it by having a child and passing that disease on to them. Because if you have it and you don't pass it on to children, it's done. It stops right there at that genetic line. There's no way it skips generations. It's either there or it's not. So, in closing, if you have a suspicion that you have this disease, get tested for it first. That's the only way to prevent passing this disease on. Thank you.